Hi, I'm Elinor Hiller. There's been a lot of buzz in the health IT policy space about TEFCA. So we wanted to talk for just a minute about what it is, where it came from, and why its release marks an important milestone for policymakers. TEFCA is an acronym for the Trusted Exchange Framework and Common Agreement. So that's two parts. First, the Trusted Exchange Framework. This is a set of non-binding principles established to facilitate data sharing nationwide among health information networks, or HINs. The principles include things like standardization, privacy, security, and safety, and public health. In practice, HINs already follow many of these principles, but the TEF is intended to further advance their use. The idea is that alignment with these principles should help facilitate effective contractual relationships for secure electronic flow of digital health information. Second, the Common Agreement. This is the piece designed to operationalize simplified electronic health information exchange across the country. It is set up to support a variety of use cases, including exchange of information for treatment, payment, operations, access, public health, etc. The flow of information involves a number of entities that are working with the government. The Sequoia project is serving as the recognized coordinating entity, and they will soon enter into contracts with Qualified Health Information Networks, or QHINs. The QHINs will then be exchange hubs for entities that participate in disparate health information networks. The Common Agreement is really a contract governing these entities and their roles. So putting it back together, TEFCA stands for the Trusted Exchange Framework and Common Agreement. JP, can you talk a little bit about how we got here?
Absolutely. Thanks, Elinor. The entire movement to address interoperability in the original 21st Century Cures Law was driven by complaints heard by members of Congress far and wide about a lack of the ability to share data amongst both providers and patients, despite significant federal investment. As those of us who worked on the law quickly understood, much of these issues were technologically driven by a lack of shared standards and agreement on data exchange. The private sector was already working on and addressing these issues, and while Congress wanted to support these efforts and did not want to start from scratch, they also wanted to provide the full backing of federal infrastructure to accomplish trusted data exchange. Hence, Section 4003 of the 21st Century Cures Act established the TEFCA, which sought a universal floor of interoperability. In January of 2018, the Office of the National Coordinator released the first draft of the Trusted Exchange Framework. In April of 2019, ONC released the second draft of the TEF, establishing the infrastructure and governing model for users across networks to securely share clinical information with each other under these commonly agreed to rules is an integral step in achieving interoperability across health networks. And now, 5 years post-passage of Cures, is a major step towards realizing its original legislative intent. From here, next steps will include work that will support FHIR exchange in the TEFCA. Elinor?
Thanks, JP. So this week marks a major milestone for policymakers who've really been working on this for years, and it also kicks off the next phase. We think there will be plenty of opportunities for stakeholders to weigh in as rules and standards governing electronic health information exchange continue to take shape. So thanks for tuning in and listening to this Healthy Byte.